morning, Anonymous. We find ourselves in Langebaan at another new studio that Dr. Candace has joined up at. Dr. Candace, thanks for joining us.
Thank you so much for having me.
Dr. Candace, can you tell us where exactly are we?
So we are at Silverleaf Aesthetics in Langebaan. So it's part of the Langebaan Country Estate. I work with the somatologist Kaylee Keller, which owns the establishment. So I'm here once a month at least. So sort of juggle between clients.
And now how long have you been at the studio for?
I started here sort of end of last year. So at least once a month since about August last year. Yes.
Okay. And what all do you offer for the people of Langebaan?
Okay, so different aesthetics treatments, so things like botulinum toxin treatments, dermal fillers, including like cheek and chin filler, lip filler, things like biostimulators, as well as sclerotherapy and lipolytic injection.
And now for the viewers that don't know, can you go into a bit of depth of the exact procedures and what they do for you, let's say?
Okay, so the two main ones that we or that I see mostly or perform mostly is the sclerotherapy and the botulinum toxin treatment. Fillers to an extent, yes. So botulinum toxin is a medication we inject directly into the muscles of facial expression. So patients that have forehead lines or frown lines, we are able to soften those with repetitive treatment. So every 3 to 4 months, it basically temporarily paralyzes the muscle to help with prevention or formation of those fine lines. And then sclerotherapy is the treatment of spider veins or varicose veins. So it's injection of a product that damages the vein wall lining, and essentially the body breaks down the spider veins or the varicose veins over time. And then dermal fillers, it's a hyaluronic acid-based product. So it basically can pull water. It's very hydrophilic, so it adds volume back to the face. So over time with, for instance, aging and weight loss, patients can experience volume loss in the face, and we can add that back with filler. So either in the cheek area, in the jawline or chin, help sculpt that area, as well as into the lips, so lip filler. Yeah.
And now yourself, what put you into this profession?
So I'm a qualified medical doctor, and I've always loved aesthetics. I've loved sort of an aspect of dermatology in the beauty side of medicine. So essentially that's been my passion, and that's why I decided to rather step out or away from the hospital and start doing aesthetic medicine.
And how long have you been doing it for?
It's about 2 years now, yeah.
2 years?
Yes, so finished qualifying and obviously getting all the degree, everything.
And you did your qualifications in Stellenbosch?
Stellenbosch, yeah. Stellenbosch University. So it's a 6-year degree, and then you do your internship years, community service, and then you have to do a whole bunch of postgraduate courses to be able to do aesthetics as well.
And now you're in Langebaan, Saldanha. I think we interviewed you Bloberg side as well, but now you said you're in Robertson, I think it was?
Yeah, so I'm in Robertson once a month, at Mooi, Laser and Aesthetica. Traveling around. I'm perhaps looking to go to Worcester side sometime soon, so traveling a lot at the moment.
So soon to be all over the Western Cape.
Absolutely.
And is there anything that you would like our viewers to know that you maybe haven't touched on in our previous interviews?
So I just think it's important that each patient is different. Each patient, not every treatment is for every patient. I'd like to, if patients have any questions, they can come in for a consultation first, and we can always see or discuss the certain possible treatment options. And very important that I try to focus on natural looking results. So aesthetic medicine is a journey. We don't have to do all the treatments all at once. It's basically we can tackle it in a staged approach, but if patients are uncomfortable with sort of what the treatment is and what it entails, they can always come in for a consultation first, and we can see which treatment would best suit them.
And now what age groups do you work with?
Typically, I wouldn't start any aesthetics treatments in patients under the age of 18, but I usually work with patients mid-20s all the way up to 60, 70. So it's really, there's not really an age limit to it, but I wouldn't start any aesthetics treatments below 18 years old, yeah.
And now if anyone wants to get hold of you, Facebook page, contact details, anything like
So
that?
on my Instagram, it's all my information. So it's Dr Candace La Marque Aesthetics. Yeah.
On Instagram?
So on Instagram, and then they can find all the links there and before and after photos, which are quite nice. So
I think it's always good to see the results that you get from the work before you dive into it.
Absolutely. There's also some educational information on there. So explains what the certain different procedures are, what to expect in terms of recovery, things like that. So on my Instagram page.
Dr. Candace, thanks so much for taking some time chatting to us.
Thanks so
I
much.
wish you nothing but best and strength. I mean, you're going from strength to strength by the sounds of it.
Thank you
And
very
yeah, we're
much.
looking forward to seeing you all over the Western Cape.
Awesome. Appreciate it.
Cool. We'll see you guys next time.